including 288 deaths. Over 71,000 Missourians have been tested at this time. As you know, we are moving into the recovery phase of COVID-19. Missouri took early, aggressive, and smart actions to contain and slow the spread of COVID-19. Thanks to these efforts and the incredible sacrifices of Missourians who stayed home and practiced social distancing, we are successfully flattening the curve. With the help of all Missourians, our plan is working. The healthcare system is not overwhelmed, and we are winning the battle. With favorable data and approval from state health officials, we are ready to take another step forward in the recovery of Missouri. As I have said, this will be the turning of a dial, not the flip of a switch. Our Show Me Strong recovery plan is developed with Missouri-specific data and the expertise of infectious disease doctors, state health officials, medical experts, and members of our fusion cell. The recovery plan is responsible, effective, gradual, and safe for Missouri. Mirroring President Trump's guidelines, the 4 essential pillars of our recovery plan give us a benchmark for moving forward. I also want to thank the President and Vice President who mentioned Missouri's model last week in their press conferences that we, with our Google marketing, that we were able to connect providers with our local businesses of over 200 people. It was a great opportunity to recognize Missouri and the hard work of people in this state. And I thank both the President and the Vice President for that acknowledgement. Today, I would like to share the data supporting these 4 pillars. We have said a big part of our Show Me Strong recovery is expanding our testing capacity. Right now, between the Missouri State Public Health Lab, private labs, and participating healthcare institutions, we can test those who are currently contagious and those who have developed immunity. We are also prepared to go into hotspots and with the box-in approach. Contract tracing is also key to prevent the further spread of COVID-19, and we will be assisting local public health partners in their efforts. We will be able to target hotspots with contact tracing and provide support for local health agencies. Expanding our PPE reserves and using public health data to predict potential outbreaks are also an important part of our plan. Today, Director Todd Richardson is here to give more details on these 3 pillars. Todd?
Governor, thank you and good afternoon. As the Governor mentioned, we've been working incredibly hard to try to get the state of Missouri in a place where we can feel confident about the 4 pillars the Governor has laid out. And so over the last several days, we've made tremendous progress on a number of fronts. First, the state of Missouri has rapidly expanded its testing capacity and its access to testing supplies. This week, Missouri entered into flexible, ongoing contracts with private laboratories, including those based right here in Missouri, like GeneTrade and Viracor. These labs have already supported testing to contain and prevent outbreaks in essential businesses and correctional facilities. As the state and private lab capacity supply expands, the Department of Health and Senior Services has expanded guidelines for eligibility to be tested at the State Public Health Laboratory. And finally, private physicians should feel comfortable and encouraged to order tests through private labs at their discretion. This week, the state, in partnership with our local public health agencies, has begun a program of community sampling in our hardest hit areas in Kansas City and St. Louis, as well as some of our most rural areas. Community sampling will give us an additional source of data and provide a snapshot of disease spread in key geographies. This effort would not be happening without the hard work of our local public health agencies, the often unsung heroes who have been at the front lines of this event from the beginning, and they answered the bell again, working through the weekend to get these sites up and running. By Wednesday, 4,000 Missourians who were previously unable to access a test for COVID-19 will have had a test. This effort will be coordinated with a locally run community sampling program in St. Louis, for which the state has contributed 1,000 test kits. In addition, we all know that personal protective equipment is a key piece to ensuring we are ready for a recovery. Last week, the Department of Economic Development, in consultation with a wide array of state government employees and private partners, has launched a PPE marketplace. This marketplace allows public and private buyers and sellers of PPE to determine demand and supply of all types of personal protective equipment. As of this morning, there were nearly 900 buyers and 223 suppliers registered in the DED marketplace. These purchases will be used to supplement existing PPE supply chains overseen by the State Emergency Management Agency, and also to ensure that we have adequate reserves. We are actively responding to the nationwide PPE shortage, not just with better access to the supply chain, but also with innovative brand new technology. This week, a new Battelle decontamination unit will begin using vaporized hydrogen peroxide to sanitize N95 masks. It is capable of decontaminating up to 80,000 masks per day. These critical steps move us further down the path to a safe, a sustained, and a robust recovery. Thank you.
All right. Thank you, Todd. Monitoring and expanding hospital capacity is another essential pillar of the recovery plan. Our hospitals are stable. All regions have demonstrated reductions in hospitalized cases, with the exception of St. Louis. St. Louis data appears to show stabilization of cases, but not yet reductions. Today, Missouri Hospital Association President and CEO Herb Kuhn is here to share about our hospital system. Herb?
Thank you, Governor, and good afternoon. Hospitals across the state are grateful for the overwhelming community support the physicians, nurses, and those who work in those institutions have received over the past month. The kind messages, the prayers, and donations have made tremendous difference for these caregivers. Hospitals are also grateful to Governor Parson and his administration who have led us through some extremely challenging times. And the public is to be thanked, for it is through their adherence to social distancing and stay-at-home orders has helped to slow the spread of COVID-19 to keep everyone safe. That unselfish sacrifice is what has brought us to the battle here today, where we can not only plan for, but begin to think about and talk about how we're going to restart the state's economy. For hospitals, that means a phased-in resumption of elective procedures. These are surgical and medical procedures that range from wellness checks and childhood immunizations to cancer screenings such as colonoscopies or surgical biopsies. The suspension of some of these procedures could be done safely and without risk to patients, but others may no longer be safe to postpone. Ultimately, it's a decision between a patient and their physician on whether to proceed with a medical procedure. But it's important to understand that we find a balance between the risk between community exposure of COVID-19 and suspended health care for existing conditions. Our plan is to integrate this resumption of elective procedures with the Governor's Show Me Strong recovery plan. And we plan to do so in a way that takes every precaution to ensure health and safety for our patients, visitors, employees, doctors, nurses, and communities. The resumption of elective procedures will be a phased approach, just like other aspects of recovery. Further, we plan to take action with the assurance of everyone in this state that the healthcare system is prepared to respond to any community outbreak COVID-19 as we move forward through this phased restart. As I shared from this podium 2 weeks ago, hospitals across the state have trained their staff and reconfigured their operations to meet current and future demand placed on them by this virus. This includes not only the surge that we are going through now, but importantly, through this entire episode until the general population has immunity or a vaccine is developed and fully deployed across the state. Our resumption of elective procedures focuses on 3 important criteria. They include the suppression of spread of the virus, protection of patients and healthcare workers, and the delivery of safe care. This translates in the need for a downward trajectory of cases or COVID-19 hospitalizations within a hospital's immediate service area, the capacity to screen and test patients and healthcare workers, and the capacity to manage COVID-19 patients in a safe and effective way, including adequate personal protective equipment and medications. And more details on these procedures are available on the Missouri Hospital Association website. As we join the state in moving forward, our hospitals want to remind all Missourians that we are here if you are having an emergency. If you have symptoms of a heart attack, stroke, or other life-threatening illness, do not delay in seeking care. Hospitals are safe and ready to help. The sooner you seek care, the more likely it is that you're going to have a better outcome. Everyone in the state can be assured that hospitals will continue to work closely with the governor and public health officials in monitoring the virus activity. We are prepared to return to more restrictive operations if needed to effectively maintain the safety of the public and our healthcare workers. But the good work and sacrifice by everyone across the state, by practicing social distancing and stay-at-home orders, along with solid planning and execution by the state, the building of capacity of supplies, testing, and new hospital beds that have come online, puts us in a place that we believe we can safely move to this next step. Thank you.
Herb, thank you very much. Thank you for what you represent, and thank you for what the hospitals has done during this entire time. Because of our accomplishments, we now can cautiously and wisely begin to reopen Missouri. Today, I am announcing Phase 1 of our Show Me Strong recovery plan. This order will begin on Monday, May the 4th, and extend through Sunday, May the 31st. Later in May, we will reevaluate Missouri data to determine what our next steps will be. Missouri's economic recovery plan will focus on the diversity of Missouri, its people, its businesses, its communities, and infrastructure, among others. A strategic reopening of Missouri's economy will not be successful without proactive steps taken by our state's businesses, our communities, and citizens to mitigate the risk of COVID-19. During Phase 1, we can gradually start to reopen economic and social activity. However, we should continue to maintain social distancing and practice good hygiene and protect ourselves and others. This will be a deliberate process and is flexible to adapt to different situations. Some communities may be able to reopen at a faster rate, while others may need to continue some guidance to keep their virus from spreading. Nursing homes, long-term care facilities, retirement homes, and assisted living homes must continue to have stronger guidance to mitigate the risk of contracting and spreading COVID-19. As far as businesses, all of Missouri businesses, employers, and employees are vital to our state's economy and individual well-being. Therefore, all businesses can open under this order as long as the guidelines are followed, such as the hospitals can now open their doors for procedures before that you couldn't have done. People can go back to church and worship in what environment they want. We have been in constant contact with our faith leaders across the state since the beginning, preparing for this day to open the churches. The restaurants will be able to open again. as long as social distancing, again, is obtained. Retail and small businesses will have occupancy limits on how many can be in those facilities, much like under the first order. Manufacturing business will be able to go back to work. Barber shops, cosmetology shops, hair salons will also be able to go back with protective guidances in place. Gyms, sporting events, and we must all practice social distancing. Opening these businesses is going to look very different for a while, but I am confident Missourians will abide by the guidance as we move forward. Today, Director Dixon is here to talk more about Missouri businesses. Rob?
Thank you, Governor. Hi, I'm Rob Dixon. I'm the Director of the Missouri Department of Economic Development. Gradually reopening our state to economic and social activity again is an important chapter in our fight against COVID. This phase certainly brings some hope for what is ahead, but it's also a period where we have to continue to be more vigilant than we even were before. As the Governor has mentioned, reopening our economy is not like flipping a switch on and off. It's going to be a gradual process that plays out in different ways in different communities across our state. How we proceed from here must and will be based on those healthcare priorities and pillars that you heard about earlier. This is not a return to normal. Instead, it's the beginning of a new normal, and all of us, our businesses, our communities, our citizens, are going to have to learn how to operate safely. Reopening our state is partly based on public policy, but more than anything, it's based on what all Missourians will do from this point forward. Adhering to this order and to the guidelines will certainly help us stay healthy and recover faster, but there's a lot more that you can do in your own business and your own community as well. We encourage businesses to implement basic infection prevention measures, including the use of protective equipment, temperature screenings, testing, and disinfection. Businesses should consider modifying their physical workspaces to maximize social distancing by adding barriers or spreading workstations apart. If it's feasible, continue teleworking or use staggered shifts and return to work in phases. We also suggest that folks should limit their access to common areas where personnel are likely to congregate or interact. We also ask that you look at your sick leave policies to make sure that they're flexible and consistent with public health guidance. These are just a few of the ways that businesses can protect themselves, their customers, and their employees. But for everyone, social distancing is critical, whether it's at work, in your community, or as you go about your daily life. Our nation and our state certainly have a long road ahead of us. We will continue to fight the virus for the foreseeable future. The Show Me Strong Recovery Plan creates a path forward for our state to reopen and to help get Missourians back to work. I would encourage everybody to find out more details at showmestrong.mo.gov. Thank you.
Thank you, Rob. Thank you for everything you're doing. At this time, we cannot cover every detail of this plan. However, we will have specific details posted on our social media accounts and on the Governor and the DHS websites. Let me just say, I'm very proud of our entire state, and I am confident in the directions we are moving. Our efforts have showing positive results. As we begin to reopen, I know Missourians will prioritize the safety of their friends and their neighbors. It is important that each Missourian has the confidence to re-engage in the economy and healthcare system. And we ask to please just use common sense. If you don't feel comfortable going out, then don't go out. Stay at home. Continue to avoid congested crowds and large gatherings. Practice social distancing. Use proper sanitation. As we begin to reopen, we will be prepared, but the virus will still be here. And just remember, protect yourself, but also the people you love. Take care of each other. And we must continue to protect the livelihoods of all Missourians. You know, a lot of people have different views across the state of Missouri what should be done, what could have been done, what would have been done. And there'll be plenty of people to second guess the decisions that are made throughout the state as the future moves forward. But I'd just like to remind everybody, what we've been dealing with is frankly less than 60 days from when it began, a little over 50 days. At the time, people didn't know what to expect. People were scared. People didn't know how this was going to come out. And everybody was trying to take the actions they thought at the time that was protective of the people of this state. People continued to do it, whether you lived in an urban area, whether you lived in rural Missouri. And people across this state took the personal responsibility to act. And I think when the day comes, we're all going to remember that. People didn't think about what the risk was at the time. The doctors, the nurses that went there didn't even realize what the risk was when they were going to work every day. Thank goodness for the truck drivers that stayed out there in trucks and delivered products up and down the state. Thanks for the people that went to the convenience stores and kept it open so people could go and travel and things of that. For so many people that stepped up, the prison guards all over the state, whether in the county or the state, the people that come in time after time to provide the services for everyday people in this state. We will look about that someday, and we're going to find out how proud we were in this state and how much better we are than most states in the United States for what people actually took upon themselves to handle a situation that we had never been into before. And I'm telling you, at the end of the day, we're going to look back on this, I believe, and Missourians are going to find out people made decisions they thought were right for the right time for the right people across this state. And I think we are going to be proud to be Missourians. We're going to find out the only way that we won on this virus and will continue to win is by all Missourians working together. And that's who we are in this state. It's working together to fight a common interest. And we have a common enemy. That was called COVID-19. And everybody stepped up to the plate to fight this in some fashion or in some form. Together, we will defeat COVID-19. And together, the state of Missouri will come back stronger than ever before. God bless you. God bless the great state of Missouri. And God bless the United States of America. We'll now open it up for questions. Also, Dr. Williams is here today. Director Carston's here with us today. And who else have I got on my director? Dr. Williams is here, Director Carston, and I think everybody else has spoke. So we're here to answer some questions for you. We'll try to make them available for the questions. So the time's yours.
Governor, you said that restaurants, barbershops, churches, they'll all be able to reopen if they follow social distancing guidelines. Will there be a capacity limit for restaurants and churches, or will people have to be spaced out 6 feet on pews? How does that all work?
Yeah, the broad scope of that will be social distancing will be part of the big scope of that, how they will do that, whether we keep the 6 feet, whether that's a family table of 4 or 6, whatever it might be, but then separate them from there. There'll be more specific guidelines. But here's the thing I think that's important to realize about that. No matter what what we do in guidelines or what we do is, from this point, I think that people are going to demand that. I think when people go out there, they're going to want to make sure if they go into those businesses, they feel comfortable and they feel safe. So I think, one, the business will have to adapt to that, and the consumers will. But I think it'll be consumer driven. I don't think it'll be so much us saying what they have to do. I think that's going to be driven that way. But yeah, there will be guidance on that.
Governor, can you kind of lay out day by day what's going to happen over the next week before reopening?
Yeah, for the rest of this week, we'll have people in here every day talking about the opening portion of it, and then we'll have people talking about some still on the COVID-19 side of it, but we'll have numerous people in every day this week to the press briefings that we'll have to be able to answer some more of those questions as we move forward. There will be the guidance will be in general, the order will be a pretty general order, and then we'll have guidance, and then we'll have the question answer part of it where people can go in there and say the what ifs, what if I do this or what if I do that. But again, people are going to have the opportunity to go back to work, and the businesses are going to be able to open.
According to the president's reopening plan, they are asking for a downward trajectory of 14 days. We haven't seen that here in Missouri. So why are we reopening 1 week from today?
Yeah, I think we are seeing that. I think we are seeing that. I think we're going to be able to have the data to show that 14-day downward spiral. Now, if you're talking about St. Louis, I addressed that earlier when it was talking point. St. Louis will be a little different on that. But again, the cities and the counties are going to be able to have their own guidance too, which assume they will.
So will the city and county's orders still supersede the state order?
Yeah, they can do stricter guidance. They can do stricter guidance. You know, it can be more relaxed than what ours are, but they can do stricter.
I don't know if this is for Director Richardson or Director Williams. I have a contact tracing question. Do either of them know how many contact tracers are currently available to the state? And will the state be providing contact tracers for county health departments that are smaller and don't have the kind of resources they need?
Yeah, I'll let Dr. Williams answer that. I think one thing in there, we're also, I'm not sure if I made that clear enough, but I'll let him answer what we have. But we're currently putting a team together of tracing that'll be able to target hot spots around the state. But let me let Dr. Williams address that.
Thank you very much for the question. As the governor has said, not only do we have to have the ability to test, but we also have to have the ability to go out and do the contact tracing when we find those. So to answer your question specifically, we have 15 people out today around the state helping with that. And we met at 12:30 today to develop a more robust capacity and to bring in resources from other departments as we make this more robust. We have more than 15. We just have those out today. We've already been committed to that. We've been in St. Louis County. We've been at Golden Valley. We're working now closely with Buchanan County. So to answer your question, we will have in place a robust capacity, bringing in initially people from other departments, but going further in the summer and fall to build up our own capacity using the money that we're receiving from the federal government to develop that. An average person in a case contact usually has 32 contacts. We also think technology is going to be a game changer here. And so we're very, very interested working with our fusion cell to see what technological advances are there to decrease the number of people. So thank you for the question.
A quick follow-up.
Governor, my question is for the governor. Have you been in contact with Illinois government leaders? The chair boardman of St. Clair County, Illinois, has shown concern about our state opening too soon because 33% of residents in the county work in downtown St. Louis. He says he wishes both states were on the same page. What is your response to that?
Well, I think Illinois is a lot different than Missouri to start off with. You can look at Chicago for there. Let me just clarify something, because I know there's been lots of reports in the media, and I'm thankful the governor of Illinois cleared that up, but a lot of people have said that we had refused to join the pack. A lot of the media outlets had said, the governor had said that. Well, Sunday he was live on, I think, Fox 2 in St. Louis and said he had never spoke to me about joining that or any discussion. So I really appreciate him clarifying that, to kind of know the truth there, that there was never no conversation between me and him about joining any state. Look, Illinois is a lot different. Chicago's a lot different. You look at the numbers over there, you can see that. I'm thankful St. Louis, when you look at St. Louis compared to Chicago, what they've done is remarkable in our state. So my hat's off to the people in St. Louis, the medical teams they got up there for the leadership. So there's not a real good comparison between, I don't think, us and Chicago.
I have a question for Dr. Williams.
Hey, let me just ask this, if everybody wouldn't mind, if you've got questions for Dr. Williams, we maybe just keep him up here for a little bit. You mind doing that? Or if something comes up, we'll bring him back to finish. But as the directors come up, we'll just let them ask questions for Nimerson. Dr. Williams?
Thank you, Governor. Yeah, Jack?
Yeah, the governor hit on this a little bit, but the White House lays out several criteria. It says that states should meet before they proceed with reopening. There's a 14-day downward trend for influenza-like illnesses and COVID-like illnesses, and the other criteria. Is the state going to release those numbers that show the data that show that we're meeting those criteria?
Well, yeah. I mean, I think if you look at the data that we post every day and our number of cases, you know, I noticed yesterday on Meet the Press, they did a map of the 17 states around us that had their peak number of cases in the last 7 days, and the only state in the middle of that map that didn't was Missouri. So if you look over the last several weeks, our cases are declining for the whole state. And as the governor just said, in St. Louis, they're plateauing, and in our conversations with them, we're hopeful that those are going to decrease. But we're also happy to describe to you those numbers that you can see every day on our website, also how our modeling shows that we are, over the next 7 days, think those numbers will continue to decrease, if that answers your question.
There are some data on the website. And I can talk with Lisa about it. But
Okay.
The influenza-like illnesses, I don't think are tracked on the website.
You're exactly right, and we're happy to share that with you. You know, we were fortunate, Jack. Usually the flu season in Missouri can go up to May 15th. This year we've been incredibly appreciative that it really started markedly decreasing about 10 days ago, 14 days. But we're more than happy to share that with you.
Yeah, and will you be tracking whether hospitals will be able to treat patients without crisis care? That's another criteria.
Yes, we will.
And whether they have a robust testing system for at-risk workers or frontline workers at hospitals?
We will, and again, in just conversations with them, I know Herb just sent out a survey about 7 days ago looking at that. We don't report this, Jack, but many of the hospitals using rapid testing, Cepheid and others, are doing testing right now of pre-op patients and healthcare workers internally, and I think you'll see more of that going forward. And so I think, you know, one thing, and I'll elaborate on your question, we really think it's important that as we re-engage, that patients go back to the doctor. There's a real risk to deferring care. And so one message, the governor and I were on call with the infectious disease doctor Saturday morning, and I was on the phone with the Missouri State Medical Association. And I just can't emphasize enough how important it is that if you have deferred anything, maybe you've got a symptom, or you have a mole that looks different to you and you think it needs to be biopsied, we really, really want people to go to their physician now. That we very much believe that there is a risk to putting off diagnosing and proceeding with tests. So thanks for the question.
Okay. And are you tracking the percentage of positive cases per day as a number, as a percentage of total tests?
We are.
And
yes.
Okay, so you have that data.
We have that data. I'm happy to share that with you, both commercial and state, Jack.
Doctor,
Yeah.
It was just a follow on Jack's.
I also have a quick follow-up. Just can you confirm that it's county health departments, local health departments that are doing the contact tracing with support from the state? And is the state planning on hiring more people to do contact tracing to support that?
Yes, thank you. We had this conversation at 12:45 today with the governor's senior staff. We are well aware that many of our local health departments don't have the capacity to do the kind of robust contact tracing we need to do. So we are committed as a state to provide that, whether it's bringing in other resources from other departments in the state or hiring people to do that. So that is our commitment to our local health directors.
Doctor, just on the downward trajectory, can you define what that means then? Because looking at the state's website in terms of cases, there are still up and down days where there are numbers that are higher than days previously. So what does downward trajectory look like for you guys?
Sure. We look at the trends. As the governor always said, you can't look at one day because, for instance, we had a data unload of 3,000 tests about 2 or 3 days ago. But I think if you'll go back for like the last 3 weeks, as I just said, for 17 states around us, they've had their peak number of cases in the last 7 days. If you go back and look at Missouri's over the last 2.5 weeks, almost 3 weeks, you will see that we were tracking, 300 new cases, that our doubling rate has significantly decreased, and that we're now on a given day just have about 150 cases right around that number. And so we are incredibly appreciative that for Missouri, that number continues not to track around 280 and 300, but is going down.
But do we have enough tests? Are we testing enough people to ensure that that is accurate?
We do. I mean, we're up doing 3,000 tests today in Buchanan County. This weekend we did 150 tests at 140, I think, at a homeless shelter in St. Louis. We did 400 tests yesterday in Phelps County. We have the capacity to test. So yes, and as the governor has pointed out, one reason nationally you see in clusters the decrease in testing is that there have been less symptomatic people. So it just makes sense that as you get into the warmer months and get out of flu season, you're going to do that. But we've accounted for that by changing our criteria last Wednesday, that we're now checking people who are not symptomatic. We're now doing, as Todd just told you, we're also this week doing 4,000 tests in areas that previously didn't get as much testing, like the 3rd Ward of Kansas City, that we would like to see, and in Mississippi County and Perry County and Dunklin County. So we're actually, this week, I would say, just off the top of my head, just we ourselves have arranged probably for 9,000 tests, and that's not even people just being tested by their doctor. That's us. So yes, we have that capacity.
St. Louis County has said they would like to see 2,000 tests a day before they feel comfortable reopening. Does that fall on the state to help them get to those numbers, or is that on the county?
I work with Spring. I was talking with her all weekend, and so we try to help them because they have the majority of our cases. So I talk to Spring about every 2 to 3 days, and I sent her 100 tests last night, to help with. I get their lab results every day at about 3 o'clock, 4 o'clock. I got them. I saw an uptick in St. Louis County. I called Spring, said, "Can I help?" She said, "Yeah, we've got to go into a facility and do more testing. Can you send them to me?" And I said, "Sure," and we sent them. So yeah, we very much value that partnership and work with them as hard as we can. Thank you.
Let me just add some. Let me add something to Dr. Williams. I want to make sure I'm clear on this, because I talked to him about that. Of the 7,171 positive cases, that is tracked from the beginning. Is that right, Dr. Williams? So you also need to take that number to realize it's never subtracted. So the people that get over COVID-19 from week 1 or week 2 when this all started are part of this 7,000 number. Because at the time we weren't tracking that. And so that number is a little bit misleading, because a lot of people now no longer have the COVID-19, that they've recovered from that totally. So it's one of the things you learn as you go. We wish we knew that. We wish we'd have done that at first, but again, it was a learning experience for a lot of us on that. So all right.
Governor, to my earlier question, what I meant was, do you have like a checklist of some sort for these last few days, or things that you need to have accomplished before reopening? What are those last pieces that you're working on this week? Yeah, most everybody that's been up here speaking to you, the directors know that there's directions they have to have, and we're making sure and tightened up all the things that we need to know, such as like the hot spots. And for a perfect example, let me say, when I say hot spots, when we had the outbreak in the prison, for example, were we able to go down there and test in large numbers to be able to contain that? When we had one at the food processing plant, were we able to get up there and be able to do that and really put that in place? Do we have the tracing program in place, which I've instructed them to have that by Friday, so that we know where we're going? So a lot of things are still in the makings of this week that we feel are important. Again, when they talk in the capacity of testing, that's something we're looking at daily. But we know that's improving over the nation. I mean, you can see through a lot of the institutions out there, more testing is going to come available. And you're going to see testing that's going to be able to be done on the private sector we're not going to know it. Eventually, that's coming. I think we all realize that. So there's going to be more and more testing that won't be recorded testing at some point in the very near future. So all of those things, we're checking the boxes this week to make sure we're ready to go on Monday. And I'm confident that we're going to be able to do that. I don't like to stand up here and brag on necessarily all my directors and everything, but the reality of it is these people have been working their tail ends off for 60 days, and even working more right now to come up to make sure, because there's one thing, and this is the law enforcement side of me. I got to be comfortable that I think we're safe to tell people to come back out and get back in the public, and I think that's important for me to know that people's safety is a priority, and these guys are responsible for that just like I am. So we're going to make sure we do all the small things. We're going to dot the I's, cross the T's.
Yes. Governor, if cases were to spike again, would you consider issuing another stay-at-home order if they do spike after you open up businesses again?
Well, I think there's a lot of ifs that go on every day. I mean, if you play that scenario out, if things got bad enough, I guess, and there was a huge outbreak, we'd take a look at anything. We have the discretion to do that. But right now, like I said, we didn't make this decision in just a week or two. I mean, we've been looking at these numbers all along. The most important thing that happened in the state of Missouri, and again, I'll just go back to the model they're using now nationally to come out of Missouri, of some of the things we're using here in this state. That was the biggest factor for me in opening the state back up, because I could see real Missouri data, and I could see really what's happening in the state. Are we prepared in rural parts of the state in small counties that doesn't have many resources? Those little health departments out there, when we talk about contact tracing, they don't have the ability to do that, so we got to make sure we got something in place to be able to cover that. And no different in the urban areas. You got to be able to see what is the need we need for them, because they're totally two different needs, and you got to meet both of those demands. So all of those things have to be put on the table, and we got to make sure that we're very comfortable that if we had an outbreak, if we had a hot spot, that we could go in there with the tools we have today and be able to handle that, such as hospital capacity, ICU beds, ventilators. And right now, we're more comfortable with that than we've been since the beginning. All right, thanks everybody very much.